It's a beautiful Saturday morning here in Lagos, Nigeria. And yay, it's the Muslim Developers MUSDEV Conference 2.0. I welcome you all to this grand event with the best of greetings by saying Assalamu alaikum wa rahmatullah, meaning the peace and mercy of Allah be upon you. I am Ibrahim Salami, a UI UX designer. I'm going to be your anchor for the MUSDEV Conference 2020. Themed, Adapting Technology, Ethics, and the New World. This conference, Bismillah, is going to envelope amazing sessions to add value to us as creatives and non-creatives. Creatives and creative consumers in the tech world. Sit back and stay comfortable and enjoy this conference. We're going to start off today's program with the opening prayer, as we have to, put all affairs the hands of the Creator, and I'm going to be doing that with the So give thanks to Almighty Allah Subhanahu wa Taala, who indeed in His infinite mercy has spared our lives till today, and we ask Him to make this conference an easy one, the beginning, the blissful one, the middle, and educating, entertaining, and value-added one, and also the end of this conference, something we'll all be grateful about. So we're going to jointly recite Surah Al-Fatiha to end the open prayer. بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. So the next agenda on the agenda is to have the welcome and opening keynote address by the Amir of the Muslim Developers, in person of Amir Ilyas Durusiri.
Hello. Hello, yes, assalamu alaikum rahmatullahi wa barakatuh. I am super excited to be having us here, and I pray that this will be beginning of better things ahead for us. Alhamdulillah. We all have a vision of success in life, good health, wealth, successful career, great and well-received product. I believe that these are visions, and we've all from childhood, things that we've all dreamt of. This was my vision way back when we started the first Islamic, or rather, halal multi-vendor e-commerce platform called Souk. Souk being Arabic for the markets. Idris, my colleague, and I had this big vision. We wanted, just like everyone, good health, wealth, successful career. And yes, we were busy researching, reading, trying to be relevant, and also trying to build a great product. But then we were in for the shock of our life. There were some things rather we haven't mastered enough to get us up and running, and within years, an investment of millions went down the road. We didn't know how to bootstrap a good product just yet. We were still trying to have a good tech career. Even the ethics of the business, I later found out that we tweaked the halal a little towards haram, among other things. Alhamdulillah, we have since gotten past that. And Alhamdulillah, Idris is the head of growth at an investment company, and I am a software lead at a STEM education company. So today, we tend to address areas that we had known, if we had known back then, maybe just maybe we could have prevented the death of SUCOP. But what we want from you at the end of this event is a you who is well-defined in a tech career, well-defined in tech, bootstrapping a profitable business, and also, most importantly, helping our youths get past these trying times. You will be learning great software libraries like React, and can also automate certain tasks using Slack and PHP. You will be building projects that can be added to your resume, and it won't just be you consuming. We hope we can get your reaction as much as possible. There will be Q&A sessions. There will be quiz sections as well. Yes, you heard me right. There will be quiz. There will be a lot of gifts from companies like Ustaki. Ustaki will be giving us scholarship to their micro degrees, and 12 of you attendees will be beneficiaries to this great platform. Also, there will be data gifts, among other things, that would be shared during the course of this event. Alhamdulillah, thank you for taking your time to be among this great organization called Muslim Software Developers. In as much as it is titled the Muslim Software Developers, most of the events we do, we try as much as possible to push these events to virtually everybody, Muslim, non-Muslim, whatever you are welcome to keep benefiting from this. Honestly, you mean a lot to us for being part of this conference, and by Allah, you will surely get the benefit of this great event. We would love to thank our sponsors. We have Ustaki, which happens to be Africa's first online Stack Learning Institute to become first online Stack Learning Institute, which helps you to become a world-class professional in any IT career of your choice. Also, we thank Majad Tech, which is an online and communication technology company with well-tested software in hosting, inventory management system, cloud services, among other products. Then we also thank JB Tech, a digital agency that helps small and medium businesses thrive online. They provide digital services and solutions to SMEs. Shukran, thank you very much to everyone who has made this event a great success. You all know yourself, all of the organizing committee. Wallahi, even though there were some few skirmishes along the line, alhamdulillah, I'm happy that we've made this a great success. We've made this happen, and I pray that Allah continues to guide us, and may we get the benefits of this. We'll move to the next thing on the agenda, which will be the MUSDEV story. Please don't forget to tweet, Facebook, TikTok, Instagram using our hashtag MUSDEVConf20. It will be scrolled at the bottom later on. Jazakallahu khairan. Thank you. Bye.
All right. Thank you very much, Amir Ilyas Durjai. Thank you very much for that beautiful address. Jazakallah khairan. And I'm very sure every single one watching or attending this great conference is excited to learn from the great packages that MUSDEV has in store for them, ranging from business, technology, health, and workshop. And it's actually very exciting that there is actually a community for Muslim software developers, something that will actually help Muslims to be, confident in building a creative culture. And also, it's actually amazing about the fact that Muslim software developers is actually dynamic to actually have a platform for both Muslims and non-Muslims alike. So I hope we all get the best from this great conference. And next thing on the agenda is to listen to the beautiful story of how the Muslim software developers was actually formed. And to do that for us is going to be our Amir, Elias Durujai, and also co-founder in person of Yusuf Jimo Aweda. So I'll give both of them, the Amir and Yusuf Jimo Aweda, to come to the beautiful story about how MUSDEV was actually created.
Alhamdulillah, good to be back as well. Still trying to wait for my colleague, Yusuf, with that. Pending that time, I think Ibrahim Drosimi will be joining us now. Yes, so for MUSDEV, well, MUSDEV started as a set of we software developers trying to come up with certain try to have a group around we who have achieved at least something within the tech industry. You know, it's the goal behind it was what can we do as individuals to, you know, collectively assist other Muslims who probably are trying to get into the tech industry, or they are in the tech industry and trying to grow their tech career. So that's pretty much why we did create MUSDEV, Muslim Software Developers. Initially, we started with, you know, thinking that we would have a situation whereby it would just be software developers. But over time, we've seen that, yes, we would have to, you know, bring more people on board. We have people now in the tech industry, general tech industry. We have data scientists. We have software developers. We have DevOps. We have digital marketers, and we even have entrepreneurs among us. So that's how MUSDEV has grown to become this big right now. Alhamdulillah. So that's pretty much about how we started MUSDEV. Over to Ibrahim Salami again.
All right, indeed, it's actually an amazing story. Getting to know how this particular platform was created, and it's actually a plus for the Muslim community. And I'll just like to ask if Amir sit with me. Where exactly do you see MUSDEV in the next, let's say, 5-10 years?
Well, honestly, so that's actually a big one. What I envision for MUSDEV is having a platform whereby youths, kids, women, wives, sisters, and thereabouts can actually come to, and we can mentor them from the budding stage to getting to become an expert in the industry, and so that they become very, very much useful to the world at large. And that's the goal. So I would hand over to Ibrahim Drosimi now. He has just joined me, so to take over from there.
All right, that's great. Yes, oh, right. Assalamu alaikum, brother Ibrahim. How are you doing? I believe brother Ibrahim can hear me.
Hello.
Assalamu alaikum. How are you doing, brother?
Yeah, I'm very fine. Wa alaikum salam. Can you hear me?
Yes, I can.
Okay, awesome.
Yeah. So you can carry on. I think Ilyas actually wanted you to continue, give us some interesting insight about the MUSDEV story.
Oh, okay. So in all honesty, I think Elias and Yusuf are there, like in the best position to say the full story. Idris and Elias, sorry, Yusuf and Elias did conceive the idea. I joined much later, and for me, what really drew me to the group was the fact that they were trying to put together what's called a group of Muslims to specifically nurture the younger generations. We all know the way it is generally in the economy. I mean, all of this unemployment thingy. And because prior to that, I was at work in HR to an extent. And I realized that a lot of times when we put out, what you might call it now, vacancies for some clients, well, for some reasons, the bulk of the applications we get are mostly those from the other faiths. So when Elias told me about MUSDEV, I was like, you know what, this is something we have to do. This is something I would love to be a part of. especially so that we can nurture a younger generation of Muslims to come into the tech space and be able to create solutions that would address Islam as a whole, that would address the economy we live in, that also would empower several individuals to be able to also feed their own families as well. And alhamdulillah, we've grown a lot from 3 years ago, thereabouts, when the group started, to what we have now today. And for some, and also interestingly, I'm also not a core tech person like that. I'm between tech and business. So the group as well also accommodates people who also work in the intersection between technology and business. So whether you are into marketing, digital marketing, product management, product development, everybody too is welcome on the group. And alhamdulillah, we thank everybody that has helped us come this far. A lot of people have put in a lot to get the group to where it is today. I don't know if Idris is on the call as well. Idris, Yusuf Aweda. They will also have more angles to bring to the MUSDEV story. But I'm proud to be a member of the MUSDEV. I'd really, really learned a lot. I'd had so many resources shared. I've been able to learn a lot, meet so many people to also help my own individual career ambitions as well. So over to you, Ibrahim Salami, my namesake.
Thank you very much. That was indeed a very beautiful part. It's actually interesting because I myself have, some few things to say about MUSDEV. I think I got a job, a few weeks ago, just joining the community, and it's actually very interesting and it's a plus, like I said, to the Muslim community. So I don't know if Elias the Amir has something else to actually dip in to buttress the MUSDEV story. Is the Amir with us?
Yes, he is. Is coming back now.
Oh, okay.
Okay, yeah.
Great.
Well, alhamdulillah. Yes, well, he has said it all, and I believe I said much that we'll have to add at this time because we have very limited time available for us. I think we've far exceeded the time given to us, and we, as Muslims, we have to be wary of time. So we would go on to the next one. Yes, so we would be showing some adverts from our sponsors. Thank you.
All right. So thank you very much, Amir. It's really, really great, listening to you guys talking about the whole journey. So I ask Allah Azza wa Jalla to, make this one a fruitful one now and the nearest future. So quickly, the next session, we're going to be having the first panelist session for the MUSDEV Conference 2.0 2020, and it's going to be talking about, we're going to talk about health tech. So, but before that, we're going to go on a short break.
In today's world, IT professionals such as software developers, data scientists, UI designers, and many more are one of the most sought-after professionals. Therefore, choosing any of the IT career paths is a smart choice. However, as an African, acquiring the necessary skills to become a seasoned IT professional can be challenging. You have to deal with a lot of poorly made instructional materials, courses that make every concept more complex to understand. And if you're fortunate to find a really good learning resource, the cost will be far from affordable. This is why we created MUSDEV, the first online stock learning institute in Africa that teaches industry-relevant IT skills at a very affordable price. How are we different? MUSDEV takes you from zero to world class in your chosen IT path by offering very affordable micro-degree programs with detailed, high-quality videos, quizzes, and assignments. Just to make sure you understand every concept as expected. Our programs contain localized content tailored specifically to Africans. And that's not all. We also offer insightful code review to solutions from assignments. MUSDEV mentors to guide you along on your learning journey. Discussion forums where you can meet other students. And whether you are at home or on the go, on PC or mobile, you can always practice what you have learned with our easy-to-use live code editor. Upon completion of any USTACI micro degree, you get a certificate of completion, resume review, and an opportunity to start earning, either working for USTACI as a code reviewer, working on paid gigs, or getting a job through the USTACI Jobs portal. So, are you ready to become a world-class IT professional and get the opportunity to earn immediately after graduation? Head on to www.ustaki.com or download the app on Google Play Store. Ustaki, your stack learning companion.
Wow, that was a really great advice from Ustaki. Application and learn a lot from it. Welcome. I have Hamid Sanusia, who is going to be my co-anchor for today. Assalamu alaikum, Hamid. How are you doing?
Walaikum salam wa rahmatullahi Ibrahim. I think it has been an amazing journey so far, and it is great to be on MUSDEV Conference 2.0.
Yeah, sure. Alhamdulillah. It's actually nice seeing your, handsome face again, mashallah.
Everybody knows who's handsome, yes.
Cool. So now quickly move to the next agenda, and that is to actually move to the first panelist session, like I said, for the 2020 edition of the MUSDEV Conference. And we're going to be talking about, health tech in Nigeria. We all know that tech is like the new oil in Nigeria. Well, aside onions, I've been have it. So we have, we have a great market for health tech in Nigeria. And so we're going to be looking at, for the panelist session, we're going to be looking at health tech in Nigeria, the challenges, prospects, and regulatory environment. And to anchor the session, yes, so we'll be expecting Mr. Mara Bello, who's going to be the one moderating the panel session for health tech.
Assalamu alaikum warahmatullahi wabarakatuh. Okay. Naam, alhamdulillah, rabbil alameen. For today's session, we pray Allah make everything we'll be discussing today an easy one for us, and we pray makes the whole conference a successful one. Amen. Now, so here we are today, 14th of November 2020, our MUSDEV Annual Conference 2.0 is here live on YouTube. And here we have our panelists. We have one of our panelists on ground by name Dr. Lawal Bakari. Dr. Lawal Bakari, welcome.
Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh. How is everything over there?
Everything is really cold.
Oh, okay. Alhamdulillah. Thank you so much for joining us today on this panel session. So we'll be expecting Dr. Olatokunbo Otitoju. So I'm sure he's going to join us soon, inshallah. So to begin with, we'll be discussing the health tech in Nigeria. And just a brief introduction of our panelists. We have Dr. Lawal Bakari. Dr. Lawal Bakari is the founder and CEO of EPID Alert. The EPID Alert Clinic is a global health security and awareness platform that provides Ebola response experience to prevention, detection, and response of infectious diseases like malaria. It uses appropriate technologies to implement models that are capable of strengthening the narrative for the impact of health promotions, health communication, and marketing practices on health outcomes of developing countries through design, research, lean execution, and capacity building. Welcome once again, Dr. Lawal Bakari.
Thank you for having me. Thank you for having me, and thanks for putting together this very important conversation.
Okay, thank you very much for that. So we all know, health situations in Nigeria, the health sector and everything. So that is why we have put up this panel session for you to help us do justice to some rising questions in health sector. And for this session, we will basically be discussing about the use of health tech, that is, how we can use technology practices in our health sector. So I hope you'll be able to do justice to our questions and, have our audience go on with your, go home sharing from your wealth of experience. So to start with, please, I'd like you to give us just a general introduction of what health tech is all about, stating facts around its market size and potential for scale, using Nigeria as case study.
Okay, thank you very much. Once again, thanks for putting this together. I hope you can hear me well. Let me start from there.
Yes, loud and clear.
Very good. Thank you very much. In terms of the subject, technology and healthcare and how they work together, depending on where we are looking in the entire technology curve, Nigeria has been participating, even if it is just as consumer, in the whole technology and healthcare space for, of course, over a decade, over 2 decades, over 3 decades. What we might say is that some of what we term digital, were not internet-based services. Some of them, when we started digitalizing some of our medical diagnostics tools, especially the chemical laboratory and some of the microbiological laboratory services, and even some of our typical medical indicators or parameters measurement. So you probably might have heard of digital BP measurement tool, all those ones that you use and then it read numbers.
Yes.
We played a lot of role as consumers of some of those solutions, maybe not the cutting edge part of them. And I'm also aware that we also try to be part of the technology development itself. So if you go to a typical school of electrical electronics, you will find guys who might be playing in a corner of biomedical engineering. In fact, one of my dad's close friends was a biomedical engineer. He studied in Liverpool and he worked in Luz till he retired. And these were guys who were responsible for some of the, or most of the digital devices that we're using in the teaching hospital and the College of Medicine. They were the ones fixing it. And some of these guys are even still in some schools of engineering in Nigeria till today. I think most of them are in the Southeast. And the truth is, most of our schools of electrical electronics engineering, they actually have the capacity to build some of those solutions, because most of them are just based on basics of parameters, maybe using colors, maybe using heat, which you can use your sensors to pick and then develop digital reading and numbers around that. So those have been in play for a while. But then recently, we now start to pivot into use of computer technology deliberately. 1989, IFE, University of IFE, that's OAU now, started what we call the Made in Nigeria Public Health Information System, which was back then, one of the leading use of the modern technology, computer technology now, which is IT and data for health purpose. And when we say health technology, we might always think it in terms of medical records, medical information, or
Sure.
hospital information. But
Yeah.
definitely, as this conversation goes on, we will discover that this scope is a lot
Beyond that,
more than that. So
encompasses more.
of course, we shouldn't box ourselves in that space. However, that space is also one of the biggest. So right now, IFE started in 1989. The project never scaled out of IFE, which may now bring us to what is the true scope of the market. Right now, I don't think we've even done any proper market calibration of what it might be, because that would be a lie if I tell you that's true, because it's part of what I hope we can drop on this conversation to say that, look, this is a market that is potentially very vibrant, but in terms of participation and influences of the tech ecosystem broadly, it's been really slow. And the reason it's slow is first because I was just discussing one of my senior colleagues in University of Lagos this morning. Is one of the lecturers there, that this is a market that is potentially big, but the ecosystem around it, that is healthcare now, the ecosystem is not as vibrant as probably you will find in like entertainment. So the Nigerian entertainment industry, for instance, is quite vibrant. You can see from the artists to the distributors to the networks, everybody's playing quite active role. Every morning you are hearing a new record is coming out. For healthcare, it's really slow. So we won't be able to start talking about this is the actual size of the market. However, every Nigerian is a consumer of healthcare. Healthcare, unlike luxury good, even unlike entertainment. I'm sure a lot of people on this conversation, they don't listen to music. They don't participate in one or some of what we call entertainment sector today.
Yeah.
However, healthcare, everybody needs it. That is actually the market. It is actually it's a public good. Healthcare is a public good. It means everybody also is, there's what we call public and merit good. Public is what everybody needs. Merit is what everybody needs at a very, very high quality. So healthcare is a public and merit good, which means every Nigerian deserves to have quality healthcare. That is from the consumer side, that is the beginning of how we should think of it. And in every population.
Okay, Dr. Lawal, please, I'd love you to go on, but then time is fast spent and we have more questions to cover up. Thank you so much for that general introduction. And as we say in Nigeria, when we want to try to, familiarize ourselves with some people, we say we want to farm some people. So you mentioned UNILAG, and I'm proud to say I'm an alumnus of UNILAG as well.
That's very good.
So yeah, so I think while we were on that, Dr. Olatokunbo Otitoju joined the call. He joined the session rather. Dr. Olatokunbo Otitoju, are you here with us? Okay.
Yes, I'm
perfect.
with you. Can you hear me?
Yes, loud and clear. I can hear you.
Very good.
Assalamu alaikum. Welcome to MUSDEV Annual Conference 2.0. Just a brief introduction about you. Dr. Olatokunbo Otitoju is a medical doctor with keen interest in healthcare delivery and financing. He is the group head customer benefits and claims management at AXA Mansard Health. He has worked on making healthcare affordable and accessible to Nigerians via private and social forms of health insurance, leveraging technology to improve service delivery. He has artificial intelligence certificate in healthcare at the MIT Sloan School of Management. Welcome, Dr. Olatokunbo Otitoju.
Thank you very much. How are you today?
Fine, thank you. And you? How's everything over there?
Fine, thank you very much.
Yeah, good to hear. So we welcome you once again to this session, and we'll be glad to share with you from your wealth of experience. So while you joined in, Dr. Lawal Bakare was giving us a general introduction on healthcare using Nigeria as a case study. So just in 1 minute, can you just as well give us a general introduction on health tech?
Yeah, so health tech is the adoption of technology in the process of delivering healthcare, compared to the orthodox methods of delivering healthcare services. So health tech has grown in Nigeria over the years in different aspects. Electronic management of records, telemedicine, health information systems, um, online pharmacy systems, um, health search, health trainings, diagnosis, genomics, and several other areas where technology can be used to deliver healthcare services. So,
Okay.
Nigeria, as we know, technology is, you look at Nigeria critically, you look at a low income country, you look at a country with a very large population, um, you look at poverty as well. You know that something must give. We have to find ways of solving our problems. If you have a population as large as Nigeria and then we have low income, then we have to find smarter ways of doing things. If
Yeah.
we do not and we want to approach this issue in the conventional way, we'll fail at it. So technology is the only way to drive this kind of success that we need in the healthcare space. And the earlier Nigeria realizes it, the better for us.
Thank you very much for that. Thank you so much for that general introduction. So back to you, Dr. Lawal Bakari. I have a question for you. Though I know you mentioned something about online medical appointments and all of that earlier, but could you shed more light on that? Like these areas, like booking appointments online, telemedicine, web-assisted diagnosis, and so on. Do you think there are areas that can they have opportunities in Nigeria? Do you think there are areas with opportunities in Nigeria?
Yeah, thank you very much. I'm happy that we have a health insurance person in the conversation. So it helps to put perspective into some of these things. So everything depends on the economics. First is yes, in terms of population size and potential market. Yes, the potential market is there. But the question is, like most of us on this call, there have been instances where you have a headache and then you call your doctor friend, Dr. Bakari, please, I'm having a headache. What should I do? What should I use? Most of us got used to this, our home economics and home support system, where whenever we are ill, we are always quick to call a friend or for a people. That is purely use of what the telemedicine, advanced telemedicine service looks like. But what we've been doing for a long time is who pays for that transaction? Who even do we even reflect on the economics of it? So in terms of market opportunity, yes, it is there. Even looking for me, the way I look at it, it usually relies on our internet penetration and our mobile telecommunication penetration. The farther that goes, the more consumers get used to using some of these technologies, the more the market systems develop solutions that healthcare can learn from. So for instance, look at the way Uber does ability to bring people to you, and then in terms of business ecosystem and insight, we see that there's opportunity. So yes, the opportunity is there. The market is potentially also there. We've experimented. I wouldn't say we've used that skill. We've experimented with some of them. So if you check some of the local databases or guys that are running these, they may have some tens of thousands of people or less in the platforms. But of course, we have not really delved into it because till our primary healthcare system, which is meant to deliver care to most of Nigerians, is leveraging these platforms, we will not be meeting our healthcare needs, our true healthcare aspirations.
Yeah. Thank you very much for that. Dr. Olatokunbo Otitoju, please, can you share with us your experience with any of these local apps or local applications rather, or health tech offerings? Can you just share any experience whatsoever you have had, maybe recently or in the past?
The experience has been great. It's not, to be honest, it's not rocket science. It's not as if we are trying to bring something from Mars or something from Pluto or another planet that we are not sure. It's simple things that we've seen in other industries like the fintech industry, like other tech industries. It's just simple way I want to talk to a doctor. Can I do it via my mobile app? And yeah, we've seen it grow. There are so many telemedicine companies in Nigeria that are doing fantastically well. Even though adoption may be very, very slow, it doesn't still mean that their solution is not practicable. And then I know some EMR companies that are in the country as well, related with some online pharmacies. We use them to deliver drugs to our patients without having to necessarily go to the pharmacy to
Wow.
queue and ask for drugs. So,
Wow.
and this COVID-19 pandemic really helped them to scale as well, because I know several pharmacies that have ordered drugs for, and they have delivered across the country.
Yeah.
Tech companies as well, telemedicine
Mm.
companies. I know some EMR companies like Helium Health, that is pushing the wave in the
Mm.
health information system. So it's not something it's not magic. It's simple. All we need is
Yeah.
just to continue to grow the industry and put a proper regulatory and legal framework on ground so that investors can have confidence in the industry and they can bring in their money to invest in the sector.
Yeah, thank you very much for that. I think the medical appointment will really go a long way in reducing queues we have in our primary health centers. Because I have, in the past, I've had an experience with a private hospital. Though they have this website where you can go online and book your medical appointments. You see the days you have available doctors. So you even see the time, and you have contacts there of who you could talk to in terms of, oh, okay, because you have maybe orthopedic, I don't know, you have orthopedic and I think physiotherapy. So for a patient, you might be thinking that, oh, maybe I need to see a physiotherapy. But once you put a call through, and probably you talk to someone and then you tell them, okay, this is my issue, this is how I'm feeling and all that, they could easily point you to another, or direct you to another maybe doctor or something, that, okay, no, this
Yeah.
is not who you're supposed to see. You're supposed to see this person and all of that. So I think is a good one. I think we are growing. Basically, I think we are growing. So Dr. Tokunbo Otitoju.
Yes.
So
Yes.
what's your opinion on challenges you have had to face in the health sector in terms of monetization, innovation, cost of setup, equality investment as against grants when it comes to like growing? Have you like had any challenges in the past?
The challenges, like I said earlier, it has to do with scalability of the business. Investors want their money back. You know, we should also not forget that health as well is more of a social good. People have to live a good life. But investors, when they bring in their money, they have to be sure that they're going to get the money back.
Yeah.
If there's no proper regulatory framework on ground, it will be difficult for anyone to bring in money to invest in that kind of sector. Because as it
True.
is today now, we don't even know what the government will do with telemedicine. Probably a minister can come and say, oh, this thing we're not supposed to do it this way. All telemedicine companies, go and register as this, go and put up one office in this place, go and put up an office in 6 geographical locations in Nigeria, go and do this and go and do that. Oh no, you can't hire a doctor over the phone. You can't talk to a doctor over. If those things are not clearly spelled out, then it will be difficult for anybody to. Right now, it's a free for all. There is no regulation. The market is just there. So in that, people will be
Like open-ended.
skeptical. Yeah, it's open ended. So now, yesterday, 2 days ago, the president signed the Banking and Other Financial Institution Act again to regulate banks and fintech industry. That's the kind of thing that pushes that industry forward. You can see how many digital banks we have now. You can open an account in
Yes.
almost 2 minutes. You can even get a loan in 1 minute. If I want a loan now, before the end of this call, this 1 minute, I'll get a loan. I'll get the money in my bank without even visiting any bank. I can pay. I can carry out transactions. I can open an account.
Yes.
So
Yes. Sure.
so that's the kind of thing that drives investors into into the space. Then the cost of setup depends on what the individual wants to do. Cost of setup can be very, very huge as well. But I know Nigeria now has good developers that can write programs, write codes, and build applications, and ERPs that can function effectively. So we don't have to outsource so much of this skill and talent. In fact, Nigerian developers are almost as good as their international counterparts now. So cost of setup may be huge. It depends on what the individual is starting with. The basic thing we need to push now is regulation and adoption. Once regulation comes in and the market is properly regulated, more people will adopt technology. There is no way out of it. Nigerian doctors are leaving the country. We still have a very high population growth, one of the highest in the region, in Africa, and in the world in general. Our medical colleges are not expanding, which means that we have, right now, I think we have about maybe 30 or 35 medical colleges in Nigeria, and they can only produce about 3,000 or 3,500 doctors per annum, and we have a gap of about 60,000 doctors. So there's no magic that we can perform using the traditional way. If we need to start producing doctors now, it will take us 20 years to fill the gap. If we decide to go the orthodox route, except we want to import doctors from India or from other places to fill the gap quickly. But our population is growing, so if we cannot do that, then we need to adopt technology to reach people. Internet penetration is at 80% in Nigeria. Almost everybody in Nigeria has a mobile phone, even if it's not a smartphone. We can find other ways of using ordinary phones to talk to people. We don't need, all we need to do is to save lives. Saving life doesn't have to be by using the highest form of technology or the highest equipment in the land. You just want to save someone's life. It's as simple as calling the person on the phone and saying, lie down on your the left side of your body, or take this drug or take this water, and the person is fine. You don't need to bring in the best professor or anything. There are systems in Kenya where midwives and gynecologists talk to pregnant women over the phone, and it has reduced their mortality rate significantly. Nice. So that's what we need in Nigeria. If I know that there are 10 pregnant women in a remote village in Kogi State, and all I need to do is just to call them to ask some questions, and if there are problems, I can easily send in the ambulance to pick them. I think that's better than leaving them stranded without any form of intervention at all. So why can't we just adopt those simple technologies? Just a phone call to 10 women. I can monitor them from my room in Lagos, because there are no doctors in some parts of Kogi State. I can do that from Lagos. I'll call them every morning. How are you doing? Can you feel the baby kicking? Do you have fever? Do you have this and that? And the woman says, oh, I'm fine. And I'll tell her, okay, go for your scan on so date. When you get back, find someone who can read English and read out the whatever is on the scan to me. If you cannot, look for a camera phone, snap and send to me wherever, if that's available in your village, and I can do that, and some of them will be fine for it.
Yes,
isn't
I
that
agree
better
with
than
you.
leaving them stranded without anything?
I agree with you on that, and I think some of our government officials hopefully are watching this, and I feel I look forward to that time where we would have this. I'm sure most of us must have watched these popular Three Idiots. That part where the woman wanted to give birth and the doctor, which is the sister, was not available. So she was able to like direct them on what to do, getting the vacuum and all of that. So I think it's part of what Dr. Otitoju just mentioned now about putting a call through to pregnant women and trying to, ask them about about whatever condition or state they are generally. So I think that's a good one, and I hope government we are going to do something about it in the nearest future. So back to Dr. Lawal Bakare. However, before I put out my questions to you, I would like to tell our audience that you can always throw in your questions, and I'm sure our panelists here will do justice to that. So, Dr. Lawal Bakari, Dr. Otitoju mentioned something earlier about regulatory bodies. He said something about being open-ended and all of that. So my question to you will be that we all know healthcare practice is regulated by professional bodies and government to avoid quackery. Of course, though, we know that cannot be curbed up 100%. We know there are still some quack doctors who give wrong prescriptions, wrong diagnoses, and all of that. But are health tech companies covered in their activities as well, or are they self-regulated? Like they are not under anybody; they are just independent.
No, they are not. They are also regulated. The only thing is that the way the regulation is currently structured is probably not as organized as you will find probably in the banking sector, because the banking sector took a deliberate transition to digitization, and then had to put their own regulations. Even the insurance sector also probably has something close. In healthcare, it is, you have MDCN looking at the physician and what the physician is doing, but you still have the nurses and the pharmacists. They also have their own councils that are looking at what the professionals are doing. In terms of the work that they do, there is the Health Information, I think it's called the Health Information Organization of Nigeria. I've forgotten their name, but there's also another regulatory body that is responsible for managing of medical records. I think it's called Medical Records Council of Nigeria. Yes, they handle the medical records. So they assume the role of who collects information in the hospital, who manages it, who stores it, and who transfers it, because they were the ones that were managing the medical records rooms, which were where we used to file the forms. But now that things are going digital, their regulation still talks about who collects information, but we always wonder if that can still stand. Right now, a doctor can sit in his office, enter the records, and transmit the information. How does that affect what they do? But outside the healthcare office itself, we also have regulations by the likes of NITDA that is trying to control the broad information architecture of the country, especially looking at data protection, among other things. Because it is healthcare, there are global regulations, there are also local regulations. In terms of information generally, you've heard of the likes of GDPR and co, which still also talks about information regulation. So there is all of the broad body of regulation on information itself, which we need to listen to, so we can put that in the hands of NITDA. So in Nigeria, if you want to do any health tech related, especially when you have to collect patient record or patient information, there's the body of Nigeria regulation around, the health information of the patient belongs to the patient, etc., etc. That is covered in the National Health Act, which is also part of the regulation. In terms of identity, we have NIMSI, which is the identity management. So the NIMSI also has a role to play, which is, at the end of the day, the way I look at the role of the likes of NIMSI is there's still the bigger NITDA, which controls, okay, this is going on with identity. Let me see, there's also some types of data that are very simple, but you won't probably understand. Things like passport number and things that are related to travel and related, that one also has to do with the immigration service, who have the role of collecting every information that's related to travel and those kind of things. Then you still have information around broad concept of communication, which you can find in the Communication Commission. So as it is, where I'm going to is, what we don't have in healthcare is a simple regulatory framework that is housed under probably one single block. We can call some of the components from different places, but put it in a simple way, so that whoever is a practitioner, that is the technology guy, or the owner of the health facility who wants to run the business, or even the patient, can rally around it. As a patient right now, you don't know how your information is handled. And if your information is wrongly handled, what do you think is wrong? You don't probably, even the doctor will just tell you, the patient information belongs to the patient. And probably the patient can even go to a hospital and say, look, I want to call my data out of your health information system. Right now, where do we tell the patient to go and read such information? You understand?
Yeah.
I mean, that's what my understanding of the current regulatory framework is. If you look at it, there are like 20 or 25 regulatory institutions and platforms that people have to piece together to form what we mean by health regulation of Nigeria, in terms of health information regulation of Nigeria. My own perception would be that over the years, guys that are in the business of technology policy, which is a very boring area of technology, needs to participate in. The Health Act of Nigeria requires that we begin to standardize most of what we do. That the 2014 Health Act. My own interpretation of that is, for the health information component of our broad health regulation, we need guys who are into policy. This is not coding, right? This is not coding. This is purely a boring area, but it's also very important for technology to stay. And of course, it might need an interaction with guys who are the practitioners. It might need an interaction with the legislators. It might need interaction with the providers and patients.
I would need to stop you right there because of time, and we have some questions, of course, from our audience. So I'm sure from the questions you would be able to even like throw more light into some things. Dr. Malatokumbo Titoju, do you think telemedicine, do you think it will be an acceptable area in Nigeria, like in the nearest future? What do you think about it?
Of course it is. There is no option. I told you already that there is no option. We can't produce enough doctors. We cannot build enough medical schools. We cannot train enough consultants to cover the gap. Nigeria is a country of 200 million people, and we have less than 35,000 active medical practitioners in Nigeria. What magic are you going to do? And most of them are concentrated in Lagos and Abuja. Lagos, Abuja, and Port Harcourt. How will you reach the person in Jalingo? What do you want to do? Do you want to send me a doctor in Lagos to Jalingo to go and practice? Do you think I will pick that call? No. It's not a clarion call now. I did my NYC as the only clarion call. Do you think I'll go to
Potiscom
to go and see doctors? To go and see patients? No. But give me a phone and a mobile app, I can help you out with that.
Okay, so you mentioned something earlier.
Okay.
Go ahead.
I'd like to add to that. So there was this report that was published in 2007 by the International Finance Corporation. They were looking at the business of healthcare across Africa and the opportunities. What Dr. Otutaju mentioned is a challenge, but it's also in itself an opportunity space. So for instance, in the organization, we started this initiative on HRH, which is a human resource in health, trying to look at how we can augment some of the missing capacity. So if you look at it, there are certain things that we can use telemedicine to do. There are certain things that you still actually need that doctor, especially things like surgery. If you say you want to do robotic surgery is expensive right now. It's not something we can think of. So
that's another thing.
Those of you who've learned of the work like the likes of Coursera have done, and now Coursera is now closing gaps in learning. So e-learning in healthcare is still another opportunity to look at, okay, what capacity, how can we scale that doctors, nurses, pharmacists gap that we have? So there's an opportunity, again, use of technology in that area.
Thank you for that, Dr. Lawal. And Dr. Tokumbo mentioned something earlier that you don't necessarily, or patients don't necessarily have to like have maybe a smartphone or something. They can just call and all. So my question to you, Dr. Lawal, is that considering that, of course, not everybody is tech savvy. Not everybody can handle smartphones. Even people who use smartphones, theirs is just, okay, let me just call. And most of the times, our mothers, our parents, it's just, okay, my child gave me this phone, let me just call. It's not like, and what they do with it is maybe post Facebook stuff and all of that. So they are not really into the, I want to handle applications and all of that. So if we are talking about health tech and we're talking about telemedicine, web-assisted diagnosis, and all of that, we want everything to be digitalized. We want everything like that. So how do you think people in remote areas, not even only remote areas, of course, remote areas is there, the network factor, how do you think they would be able to, how can we reconcile this in the health tech?
I think I understand your question very well. So what you're talking, so in healthcare, we usually talk of concept of access. And so you can talk of access in terms of, oh, I can't access the technology, right? Oh, I can't afford it. But there's also the access of building a hospital without a ramp and everything is staircase. And then someone who is disabled cannot use it. So that is also a challenge of access. Now, what we are looking at here is for those who are in remote communities or who are off the grid or those who don't have the literacy to use these technologies, there are different opportunities in terms of innovation and design to deal with some of these things. I'm sure those of the tech guys on this call, they are used to what they call user experience design, UX design.
Yes.
You are so much into all of that right now. And I'm really happy the way ecosystem is going around the whole consumer experience and all of that narrative. As a technology developer, if you reflect deeply on the user experience and the user journey, there's nothing that says that my grandma cannot use a smartphone if the UX is done really right. So that is a challenge for the ecosystem. It's not about the technology, it's about who is developing it. It's not about the consumer rather. Who's developing it? Or are you factoring how these people utilize these technologies? However, my own wife actually started a project recently around taking healthcare to the doorsteps of people, right? So there is also that process of enabling people, because my conversation back in the day used to be that in every of our 774 local government and about 7,000 plus words in Nigeria, there's at least one person who has a high school certificate who is looking for a job right now in Nigeria. And if you can remember what Dr. Otito you said, some of what we do in medicine, they are not like rocket science. If I can provide basic education on just how to do medical history, which is just basic question and answer, I can send someone to most doorsteps. And so if you think in that direction, so there's also the option of use of agents, which the likes of Pagatech have done for fintech, which a lot of guys are doing with POS and withdrawal funds right now in places that we can't find the POS. So it's innovation and thinking, it's ability to meet the consumer where they are, because that's where the money is. If you follow the money, you meet the consumer where they are, and you probably might be able to exchange funds. The guys in health insurance, they will tell you that the informal market is really tough right now. How do they crack into the informal market? And this is also a way of cracking into the informal market. If you can guarantee direct interaction with patients continuously, and this patient can afford to pay a token over a period of time, health insurance may be able to provide a package for them, but that will still require somebody to reflect on the consumer journey. So it is not about the consumer, it's about technology, and those of us that are building it. The whole concept of UX is big. The whole concept of consumer experience is really, really important.
Great one there. So from the first thing you said, it is safe to say that no matter the technology, no matter what you do, there's always downside to everything. There's always a challenge, just like you gave the maybe staircase and a physically challenged person and all of that. So no matter how we think that, oh, we want to make this thing easy for people and all of that, there will still be a little challenge when it comes to the use of technology. So for now, we will be having our questions and answers from our audience. So I hope you are ready for our questions. So here is coming from, this is coming from Sulaiman Lawal. So he said he would like to direct his question to Dr. Otitoju. Wow. So he actually specified. He knows what he wants. So how do you think the government can leverage technology in solving the perpetual problem of our national health insurance scheme? Dr. Olatokunbo, are you there? Can you hear me?
Hello?
Can you hear me?
What did you say?
Okay, so I have a question for me. I have a question for you, rather. So it's coming from Sulaiman Lawal, and he specified that he wants you to answer the question. So this is someone who knows what he wants. So he said that this question is coming from Sulaiman Lawal, and he's directing the question to you. Yeah. So he said that, how do you think the government can leverage technology in solving the perpetual problem of our national health insurance scheme?
The government can do a lot with technology, starting from distribution, distribution and payment system. Distribution is the major challenge for them, how to get NHIS to reach a lot of people. And the easiest ways for them to leverage on mobile technology, as many Nigerians that can afford to buy a phone, they can reach them via their mobile phone. You don't have to set up offices everywhere, trying to reach people on foot. You can leverage your mobile technology. Payment system is also a very important one for them. Today, you can buy airtime on your phone. Today, I can pay for DSTV on my phone. I can pay a lot of things on my phone. So why can't I pay for my health insurance on my phone? But for NHIS, probably you will have to go to their office with a teller and do all those kind of things. Those things they don't make people adopt any scheme. If I want to pay for my NHIS now, I have to go to their office in Ikeja or in Yaba, and then I'll get a teller, fill it, take it to the bank, pay the money there, and go back to the office again to tell them that I've paid, that they should put me up on their system. All those kind of things, because they don't work again in this kind of environment. So they can leverage on technology for distribution and payment system. Payment is a challenge for them. Distribution is also a challenge. About 80 million Nigerians have mobile phones. Try and reach them and tell them to pay 20 naira per day from their airtime and roll out a perfect scheme. You understand?
Yeah, I do. And I hope that answers Sulaiman Lawal's question. I hope Dr. Otitoju has been able to answer your question perfectly. So another question here from Ajibade Taufik Damileye. So Dr. Lawal, I'd like you to answer this question. He said that, is it ascertaining diagnosis about signs and symptoms?
Okay. Right.
Yeah. Then another a second question is, when speaking on the phone with a patient, won't it affect the diagnosis, since the doctor won't be able to observe the signs?
Taufik, very good question. You know that in medicine, when you are talking about signs and symptoms, there are some diseases that you can reach your diagnosis. In medical, we say spot diagnosis. You look at something, you know what it is. There are some that need you spot. Yes, there are some that need you to do palpation. There are some that need you to do auscultation, etc., etc. There are some that need you to do chemical investigation. There are some that require you to do, etc. The diagnostic landscape is very wide. But as a doctor, you can reach an initial inference, maybe from your medical history. If I'm talking to someone, the person has a swelling in his mouth. I'm a dentist. If a person has a swelling, I know what I can start thinking of. Then there might not be need for me to observe closer. Again, guys, these are the rooms for technology. This is the very, very huge room that technology has a play in mitigating some of these distance barriers that have been in this space. This space has been there for decades. Probably we are not looking in this direction. So point to make there is, yes, there are certain diagnoses, not all, that requires the presence of the physician. But there is also a very huge body of diagnosis that you can either do an initial physical interaction and then move the rest remote, because you know what is going on there. You move your follow-up to remote. So the way you can design this thing is very broad. I don't want us to go into discussing design because it will just take us all over the place. But what I know is to answer your question is a yes and no thing. It's not all diagnostics that require the presence of a healthcare worker. I don't want us to stick to the use of doctor, because there are instances where you can work with a paramedical person to be in the front line.
Okay.
And the paramedical can be there, look at the patient, and relay the information to doctor. So you can therefore use 5 paramedics to stay with 50 people, and then 1 doctor to support 5 paramedics. If you look at that model, what you are doing is a doctor is taking care of maybe 50%, and that might be real time. And so some of these things you can dump on AI. If you see A, B, C, D, AI can reflect 3 options, and you can say, okay, based on this, this is what it is. That reduces the time. It reduces your. Don't let us. The point is.
Yeah, sure.
There's so much you can do.
Okay, so we'll just be taking this last question so we can wrap up for this panel session. Time is fast spent. So I have one here from Kazim Adegbuyi, and I would like Dr. Lawal once again to answer this, and maybe Dr. Olatokunbo, if you have any additional comments to the question. So Kazim Adegbuyi says that, in what way will 5G network technology and IoT, that's Internet of Things, assist in our medical system?
Who should go first?
I don't know. Anyone of you, I don't know.
Okay, let me try. So,
Okay.
what is 5G? 5G is just very fast internet, right? Super fast internet.
Yeah. Yes.
So what that does is it just removes that how much can we transmit over the internet per time, and then in terms of how, and then Internet of Things is just basically embedding systems that can transmit internet, that can transmit data real time. Abby, that is what Internet of Things is all about. So this question is a conference. It's a conference title in itself. So I don't know where you want to.
Yeah.
So, but what I know is, some people have argued that Africa, we've not even consumed our 3G. They've done 5G, 4G. We don't even know what 4G is. We are dumping 5G, and we are chasing all of these technologies. What I feel is also, but that doesn't mean we are not going in the direction. So as not to misunderstand ourselves. What I think it is just in the speed of interaction between two ends and what we can transmit. So there are certain data, like for instance, let's use diagnostics, especially the radiographic diagnostics, where they take very huge images. Some of them are videos that need to be sent, and you can imagine sending a 5 gigabyte picture to a colleague across. Maybe 4G can do that right now, but imagine transmitting that real time. Right? Imagine and it is being transmitted real time, and they are able to have this high definition. So yes, there is a lot of room for it. It also supports things like robotics very, very well. And in terms of use of robotics, please don't let us think this medical system as just hospital. There's a lot going on in the logistics space right now.
Wow.
So if you think of logistics and the need for us to transfer vaccines now, so you're talking of COVID vaccine, the process of delivering COVID vaccine for Africa is a problem for the whole world right now. So now that they know that there's a vaccine, how do we send it? How do we track what is being sent so that people don't steal it? The way they went to steal vaccine in Kogi, they think it's palliative. The kind of thing that what you want to protect against. So this is a big definitely this is a big subject, but definitely it has a lot of solutions to offer.
Okay. Thank you very much for that, Dr. Lawal. Dr. Otitoju, do you have any contribution or addition, anything you want to say to that?
He said everything all, like but you are looking at 5G. Like, while not dismissing the importance of 5G and IoT, but we have places in Nigeria where you can't even get 2G network.
Yeah, true.
And people how many Nigerians can actually afford 5G internet and data, the cost of data that will come with it? So let's start from simple things. In Africa, we must learn how to crawl before we walk. We've not even scaled the simple issues in front of us, and they want to start running.
True.
And
I agree with you.
And for all systems, it's like that. From this 5G that we're talking about, we did not even fully adopt and develop our CDMA, our landlines and our broadband system. We jumped straight from 0 to GSM. So that's why you find in most homes in Nigeria there are no CDMA or landlines. So we are not even done with laying optic fibers and all that. We are thinking of 5G. That's 4G optic fiber lines in Lagos. You don't even have it everywhere. Now we're talking about 5G. Let's pick up USSD and see what we can do with it. Look for what you can do with the 2G network that you have all over Nigeria.
Correct.
5G, it will take us the next 10 years to even roll out 5G across Nigeria. By that time, they will already be in 8G.
Wow.
So there's so much you can say about this subject. So I think it's a conference.
True. As you rightly said, it's a conference topic on its own, as you rightly said. And I think that answers Kazim Adegbuyi's question. And so we'll be wrapping up this session. And it's so nice having both doctors here on this session to do justice to the health tech situation in Nigeria. Once again, we have Dr. Lawal Bakari on the session. He's the founder and CEO of Epid Alert Clinic. And we have Dr. Olatokunbo Otitoju. He's the group head customer benefit and claims management at AXA Mansard Health. I hope I got that correctly. So yes. Any final word in 60 seconds? Any final word to our audience?
For those who are technology-based guys, I personally want them to please look closer at the ecosystem of healthcare. I'm personally available. If you have interest in this, you can hit me up on any platform. I'll be very willing to share because this is an area that I'm not just passionate about. I'm willing to put my own resources in it.
Nice one. Dr. Olatokunbo, any final word?
I want to say that people should not be discouraged. The potential for healthcare is there in Nigeria. I always tell people that no serious investor will disregard Africa at this point, and Nigeria. The market is saturated all over the world now in those developed countries. If you want to write a program or application now in Canada, for example, you will see almost 20 or 30 different ones that have been done, and they are almost and waiting for adoption. So Nigeria is like a virgin land now that we can all come and develop. The earlier we do that, the better for us. There are lots and lots of opportunities in the health business. We need to push the government to do what is right. We need to push the lawmakers to amend the Nigeria Healthcare Act so that we can change our fortune in Nigeria.
Yeah.
Professors,
thank you very much.
Professors, training doctors and everything. It's not going to take us there. To be honest, we can't get there.
Thank you very much for that. Yeah, yes. True. I agree with you. So you can continue to join us live on YouTube or join our live chat and tweet on Twitter using the hashtag MUSDEVConf20. Use the hashtag MUSDEVConf20. We hope some other time you would always join us willingly when we call upon you. We have come to the end of this session. Bye for now.
Bye.
Bye. Assalamu alaikum.
Alaikum salam.
Hello.
Yeah, that was an amazing session from Sister Mariam Bello and the two doctors. Was the session to keep continuing. I don't know what you think, Ryan, but it was amazing.
Yeah, it was actually exciting.
The prospect of health in Nigeria.
Yes.
Yeah, the prospect of health, and then I think important things stood out during the discussion, right? That first, whatever that needs to be automated would be automated. So away from the traditional setting of having to like stay long queues to visit the doctors and the likes. So we are repositioning or revolutionizing what we see as health in the future.
It's actually bringing something new to the health industry in Nigeria. It's when we were talking, I was intrigued and I wanted like, okay, let's see where this goes. I was even thinking in my head, I have medical friends, doctors who are my friends, and I'm like, guys, can't you guys venture into this stuff? So it's amazing, actually.
Yeah, but I think the next session, because it's important, because you can have ideas and get the most important ideas in the world, right? But what changes everything is where innovation comes and money must follow, right? So I think that will lead us to our next session now, which we do well to introduce, because a lot of this has to push forward with the box. So it's where the money is, and then that's where innovation comes from.
Yeah. We actually hear people saying that they want to learn Python, they want to learn Java, or they want to become techies just because they want to cash out, Obe. So, no qualms about it, because money is great.
Foundation, right?
Yeah, money is actually important, but what exactly are the ideal ethic, to monetize your skills as a tech entrepreneur? So stay tuned to the next panel session where we'll be discussing ethical financial options for Muslim entrepreneurs and innovators in Nigeria, the challenges and the prospects. And to moderate this session is Hamida Abdurrahman.
Yeah, Ibrahim, just remind our viewers at home that we can still.
Assalamu alaikum wa rahmatullahi wa barakatuh.
I'm Hamid Abdurrahman, and I welcome you to this session on ethical financial options for Muslim entrepreneurs and innovators in Nigeria. We are here to discuss the challenges and prospects. I hope you all enjoyed the previous session on healthcare. Now, I have my speakers here. Welcome all. Assalamu alaikum, Dr. Umar Husseini, Mr. Fatai Olayemi, and Mr. Ridwan Sanusi. Welcome, sirs.
Thank you. Alaikum salam wa rahmatullahi wa barakatuh.
We are glad to have you here on this session on ethical financial options for Muslim entrepreneurs, and I believe you would do justice to everything that has to do with the challenges and prospects regarding fintech. Now, a brief introduction about Dr. Umar Husseini. Dr. Umar Husseini is the CEO and Executive Director of the International Muslim Liquidity Management Corporation. He is the acting CEO and Executive Director of, like I said, of International Islamic Liquidity Management Corporation, which is a supranational financial institution headquartered in Kuala Lumpur. I hope I spelled that right. Now, prior to this, he was an associate professor of law and regulation of Islamic finance at the Islamic University in Malaysia. Dr. Umar Hosseini was also a visiting fellow at the Islamic Legal Studies program of the Harvard Law School, Harvard University from 2011 to 2012. Apart from being a Harvard certified negotiator and dispute resolution expert, Dr. Umar has consulted for numerous bodies in the areas of law and regulation of Islamic finance research and publication, and alternative dispute resolution in Islamic law. He has well co-authored the highly coveted book, Fintech in Islamic Finance. And we also have our Muslim finance coach in person of Mr. Ridwan Sanusi. Mr. Ridwan Sanusi is a seasoned corporate trainer, a qualified chartered accountant, and a certified financial education instructor. Over the past 7 years, Mr. Ridwan has trained and coached thousands of working professionals and entrepreneurs across different walks of life, and supported them on their journey to financial success. We also have with me Mr. Fatai Olayemi, who is an enterprise development professional. I'm sorry. Mr. Olayemi has over 16 years of experience in designing and implementing enterprise growth strategies for Nigerian entrepreneurs and their businesses. So come with your questions. He's going to do justice to all of them. Now, once again, I welcome you all, sirs. We have another panelist, which is supposed to be Mr. Tajuddin Olaribibe, but he's not here yet. Now, Mr. Ridwan Sanusi, can you just give us a brief introduction to what fintech is? I mean, most of us just know that, okay, we have Shola and Ezra. In the past 2 weeks, it's all about Shola and Ezra, Paystack, and all. So can you just give us a brief introduction to what fintech is, sir?
Okay, all right. Thank you so much. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you for inviting me for this session. This is actually the first time I'm going to be talking about, fintech. So I'm really, really excited to be here with you guys today. All right. So a quick introduction to what fintech is all about. Simple definition is basically, a platform where finance meets technology, right? So where you make good use of advanced or technological advancements in the financial system, right? And there are so many areas where you would find the use of technology in fintech. So you mentioned the likes of Shola, which is who is the CEO of Paystack, which was recently acquired by Stripe in the US, right? So that is just one area. There's so many areas in fintech, like a digital bank, like Kuda, a P2P lending like Fins and Kia. You have the savings and investment hubs like piggyvest, right? And so on and so forth. So again, simple definition of fintech is where finance meets technology.
Thank you, Jazakumullah khairan. Now, our Dr. Umar Husseini, can you please tell us why we should care about ethical finance?
Bismillahirrahmanirrahim. I'd like to thank the organizers for inviting me to this panel session, and I'd like to thank the moderator, Sister Hamida. First and foremost, I think it's important for us to look at what is ethical finance itself. Again, ethical finance, it's commonly used to describe finance, which takes into account not only the financial returns, but what you call the environmental, social, and governance factors. So looking at these three factors, the environmental, social, and governance factors, one would like to ask whether this is really what we call Islamic finance. I do understand why the organizers had to use this term ethical finance, but it's good to clarify at the very beginning that ethical finance itself may not necessarily be Islamic finance. Ethical investing itself refers to the practice of using one's ethical principles as a primary filter for the selection of securities investing. Now, when you talk about personal filter or primary filter, here we talk about people who use their own judgment. Catholics, Christians have their values as well as Muslims. So some do not actually, invest in things like illegal arms, So all these filtering processes may all be regarded as ethical finance. So ethical finance generally depends on the investor's views. So ethical finance is not necessarily Islamic finance. And I would like to emphasize, here's the deal. Not every form of ethical finance is Islamic. But Islamic finance has all the elements of ethical finance. However, I don't understand what is meant by ethical finance for today's purpose. It's Islamic finance. So I would like to quickly answer the question now. Now, why should we care about ethical finance? To answer this question, one may need to look at the purpose of our creation as human beings, whatever religion you are, whether you're Muslim or non-Muslim. There is one purpose of creation. There's a creator somewhere. And the purpose, basically, as Muslims understand it, is to worship God itself. So if you talk about ethical finance from this perspective, then you talk about economic justice, you talk about being vicegerents of God, Allah subhanahu wa ta'ala on earth. And if you talk about that, you have a responsibility. A vicegerent or Khalifa, what we know as Khalifa, from the Islamic balance, involves responsibility to take care of certain things. In the Quran, Muslims believe that you shouldn't actually create any kind of facade or evil on earth. And there are verses on this in the Quran. And if you don't have to do that, why? Because Allah has made everything perfect. So the default rule generally is that everything is perfect until when human beings come to disrupt it, economically, socially, and otherwise. So ethical finance itself will actually be leading to kind of economic justice, where people will not actually act in an unjust manner to others. So there are a lot of things I wouldn't want to go into for now, but I just want to start with this kind of a global overview of why we should care about ethical finance. It actually implies caring about other people, not only one's kind of greedy kind of nature as much as possible. So as established in the verse of the Quran, I think Quran 4 verse 29, which talks about do not eat up your property amongst yourself in a kind of falsehood. It's quite important to note that the hallmark of that particular verse entails everything about ethical finance. Don't eat up your property, amongst yourself in falsehood, except when you engage in kind of mutual business transactions. Yeah, and this is what Allah emphasizes. And when you talk about this verse entails justice. You have to ensure there's justice at the center of every transaction you enter into. People must actually put principles before profit as much as possible to ensure mutual satisfaction in all dealings. Then ethical finance goes beyond just the immediate parties, but it has some implication on the entire ecosystem. Therefore, do not kill one another through your business dealings. This ends the verse. When scholars interpret this last part of the verse, for me, we need to look at the broad interpretation. Because when Allah talks about dealings, at the end of this verse, when Allah is talking about economic dealings, so that means you can kill yourself economically. You can affect other things, basically. So these are some of the hallmark of what you call ethical finance from the general perspective, without going into specifics yet. So as much as possible, I think as human beings, we have to care about this, whatever religion we belong to. Thank you.
Thank you very much, sir. Now, you've introduced us to what ethical finance is. You made reference from the Holy Quran, and you spoke generally about ethical finance. Now, thank you, sir. We would like you to tell us what currently available options we have, sir.
Okay, when it comes to the available options, I think this is a tricky question. I'm currently not in Nigeria, so I guess the Muslim coach, Muslim finance coach will be able to actually say more about this. But let me actually start with the available options based on what I know. I'm going to talk from the global perspective here. I think I've left Nigeria for the past, close to 13 years already. So, but again, not what's happening there. So I'll talk generally in terms of the available options. Now, when it comes to ethical finance, and again, I would like to focus my discussion on Islamic finance, or what is called non-interest financing. Because if you talk about ethical finance, I'll tell you, the Jews have a perfect model of ethical finance as well. So I wouldn't go into all this. We actually did a very thorough research on this about 10, 15 years ago. I mean, at the Harvard Law School, when we actually analyzed the Jewish model and the Catholic model and the Islamic model as well. So now when it comes to the available options for Islamic finance from the Nigerian context or global context, first and foremost, though this looks very kind of, interesting. People will say, come on, what about and no bank will give Qard Hassan. Qard Hassan simply means benevolent loan. You have brothers and sisters who have good ideas. They want to actually, fund a particular kind of project. They're innovators. They need money. You can actually speak to brothers and sisters around, starting from your relations, starting from your friends. People can actually give loans. This is something important. People do this. Allah subhanahu wa ta'ala emphasized on this in the Quran as well. So we have to explore this. I think our problem today is, from the economic perspective, we fail to teach this at the family level. Once you're bringing up kids, you have to start teaching them not only how to pray salat, teach them about the muamalat aspect as well. This commercial transaction, the civil transaction, how do you deal with others is very important. Because when you talk about this kind of aspect, Allah talks about in the Quran, give the kith and kin, those who are close to you, give them their rights. Their rights, and do not waste. I mean, the verse continues like that. Now, what I'm trying to emphasize here is the first layer will be those who are close to you, and this is possible because the resources are available. As much as possible, we should try to empower our younger ones, our family members. So this is where Qard Hassan comes in. Interest-free loans from the family itself. Because I'll tell you, no bank will give you interest-free loans. Because they are not Father Christmas. But possible, we have to see how we can actually tap into this. That's number one. Number two is, I always say this, the CBN introduced a non-interest financing intervention, a few months ago. And one way or the other, I'm involved on the other side at the global level because CBN is a member of my board, and we do have a lot of engagements in terms of liquidity management. How do we ensure there's enough fund across the OIC countries? And that's what I do, basically. We do it through Sharia compliant manners through Sukuk. Now, one thing I'd like to emphasize here is the facilities are there. Now, whether there's bureaucracy in accessing some of these facilities, that's a different thing. The CBN actually tried its best to establish this. And people like Dr. Jibril Salahuddin, they fought a lot, writing so many moves to the CBN. Unfortunately, those at the CBN were able to come up with this. I know them very well, those who are the core of this initiative. Deputy Governor Aisha Ahmed and others. They are passionate about this. They have provided this. Now, the way the banks, microfinance banks manage this is a different thing. So you have to engage with them and see and perhaps fulfill their conditions. I don't want to go into that. But the CBN has provided alternative, and a lot of brothers fought for this, actually. It wasn't just something to do. Now, number three, I would like to think of crowdfunding. Now, people talk about crowdfunding. How do we do it? We don't have the regulations in Nigeria. But I'd like to emphasize that in March 2020, this year, Securities and Exchange Commission of Nigeria introduced its exposure draft on proposed rules on crowdfunding. And I think this is where the tech startups, many of the brothers and sisters who are here today can actually tap into. How do you actually play that role of crowdfunding intermediaries, developing the portals? This is where you take a fee. This is halal fee, which you're going to take. When you develop the portal, people use a platform to raise funding. You can actually charge them a particular fee, which is purely Sharia compliant. So this we see all over the world. Ethics Ventures in Singapore and in Malaysia, does this all the time. So this is another. There are some others, but I think I don't want to speak so much. I want to give her opportunity to.
Thank you very much, sir.
What is available there? Thank you.
Thank you very much, sir. Now, Mr. Ridwan Sanusi, can you please tell us if there have been any successful case studies of ethical financing for innovators and startups in Nigeria that in recent times that you've seen in Nigeria?
Okay, all right. Thank you for that beautiful question. Just to quickly add to what Dr. Umar has rightly said, there are different, ethical financing options or Islamic financing options available for, innovators like yourselves. So you talked about the CVN, intervention funds, but yeah, like you said, there might be some creases that we do encounter in trying to access, these funds. And I think one of the other alternative options that we maybe need to look at is the crowdfunding that you talked about, right? And for software developers and those in technology, I think this is one area that you might begin to tap into, because there are so many investors out there, or should I say Muslim or halal investors out there, who are looking for competitive returns, right? So if you can kind of bridge the gap between those who are looking for funding, right, talking about the SMEs and the entrepreneurs, and those who are looking for those who are actually looking for investment opportunities, right? So create a platform that is structured, that is regulated, and people can actually rely on it. So this is one area that I think a lot of technological, guys can go into, talking about the crowdfunding. And I think one other area that we may also be looking at is, trying to access funding from venture capitalists, right? There's so many of them right here in Nigeria. They may not come across as Muslims, right, or halal, investors, right? But I stand to be corrected. When you're doing private equity or you're getting funds from venture capitalists, it's still in line with principles of Islamic finance, right? So some of them have their like venture platform, like City Hub, and a host of other, PE and venture capital. So I think this is also another area that we can begin to tap into. Right. So to answer your question about, innovators that have successfully accessed, financing in Nigeria, to be honest, I don't know of any personally, but I do know that there's some innovators who get funds, right? So they may not be equity funds, they may actually be grants from the government or from foreign parties. Recently I think it was even yesterday, yes, I saw a particular video on Instagram about 3 guys from Katsina, one from Katsina, one from Jigawa, and I think the other one from Kano State, right? They're currently in the UK, right? So they got, enrolled into this international program. And if they do pass the program, they will be entitled to winning $1 million, right? So they came up with a very fantastic, innovative idea. So that's one that I know. Honestly speaking, I don't know of any other. Of course, there will be a series of people doing things by the side. I also know of a particular fintech company. I can't mention the name because of confidentiality reasons, that got a very small amount of money from EFINA, right? And I think we should also try to check out EFINA as well in Nigeria. So they support Islamic finance and financial inclusion in Nigeria. So they support technology, disruptors and innovators. So they got this small amount of money, just not even up to 1 millionaire, but at least it's something that they can start off, whatever they want to do. So they got that as well from EFINA. So those are the case studies that I know about, right? So I personally do not know any innovator or any disruptor that got huge sum of money from the Muslim space. Don't forget, who have a lot of innovators, a lot of fintechs, right, getting funds from foreign investors in Nigeria. right? I mean, Kuda got, I think, $10 million, right, the other day, seed capital. Paystack got $200 million, right? So many of them are getting funds, right? So the foreign investors actually see a lot of opportunity in Nigeria. So I think it's high time we're selling Islamic finance, right, to these foreign investors. And I think one of the problems or challenges that we might be facing in Nigeria is because of the complexity of Islamic finance and the acceptability of Islamic finance itself in Nigeria. Like Dr. Omar has rightly said, a lot of our mentors, right, who are really pushing the CBN, to come up with Islamic finance models that would help to drive financial inclusion. And because Nigeria seems to be a sensitive country, when it comes to Islamic finance, people like to tag it, attach some sentiments to it, and that's why I usually advise people. So when you're coming up with an innovative model, right, so try as much as possible to look at how this model can be of benefit to everyone, right? So without necessarily, attaching some religious sentiments to you, what you want to do, right? So that for a start, people can accept what you want to do, right? So that's what I'm going to say for now.
Thank you very much, sir. Our sorry. Our enterprise development and professional, Mr. Fatai Olayemi, I would like to ask that we have Paystack, we have InterSwitch, we have Intrazat, we have Fairmoney, we have Therapy, we have Kuda Bank, as Mr. Ridwan Sansi mentioned, we have Flutterwave. Now, we have all this, but we also know that most Islamic financial institutions are not interested in startups and innovators because of the risk. How do you think we can work around that, sir?
Thank you for that question. When I'm addressing funding for entrepreneurs in Nigeria in particular, my first emphasis is not really about the money. The first emphasis is about how do we need to get our businesses funding ready, which I call investment readiness. It is not, of course, so many people will say funding is a major problem for running a successful business in Nigeria. But I say to you categorically, funding is not a problem, so to speak. But the major challenge lies in the business itself, lies in the hands of the entrepreneur himself or herself. Uh, One thing about running a successful business, whether in Nigeria or anywhere in the world, is the fact that people forget to even learn what entrepreneurship knowledge is all about. People don't get to, don't forget, if you want to be a doctor, perhaps you must have spent 7 years in the university to learn about medicine. But in business, people just venture into business without necessarily thinking about, you know, entrepreneurial knowledge. I'll give you an instance. Most of innovators, of course, they have the technical knowledge, they have the technical know-how, but when it comes to entrepreneurship knowledge, it is lacking. Before anybody can access funding, whether ethical funding or conventional one, particularly in Nigeria, the person must be able to come up with a bankable business plan. What that means is the person has a good understanding of A to C of that business in terms of business model, in terms of financial aspect of the business, in terms of even the environment, the market, the customers that the person wants to serve. But in most cases, particularly innovators, they focus more on the technicality of their business idea without thinking about entrepreneurship aspect of it. And it is not enough for you to have technical knowledge without having a good understanding of the business environment, the business model, how you want to convert that business idea, how you want to convert that technical knowledge to a money-making venture. So those aspects is very key. If we are going to have access to funding effectively, as innovators, I think it is very critical. We have a good understanding of entrepreneurship knowledge. We're able to come up with a bankable business plan for that business idea. And we must be able to communicate that business idea effectively to any stakeholder at any point in time. So for me, like I said, there's no any problem accessing funding. Till tomorrow, people are still accessing funding. I'm very happy you gave an instance of Paystack that was bought for $200 million. That business started 5 years ago, and yet some businesses started 8-10 years ago, and they are still complaining about funding opportunity up to now. As we speak, I think it was Dr. Rahman or Mr. Sanusi that talked about the fact that some brothers, some Muslims fought for ethical or Sharia compliant funding opportunities in Nigeria. And as we speak today, that has been approved by the CBN. I don't know if some of us are aware of AXMI's loan. Federal government introduced that fund. AXMI's is AXMI's, that's agri small medium enterprise investment scheme. Yes, AXMI's. Yeah. Initially, that fund was really for everybody. 5% interest, 5% interest rate. But at a point, because of the fact that some Muslims fought for it, now CBN has approved the non-interest element of that fund for Muslims. So if we check with some non-interest banks in Nigeria, like Jais Bank, like Taj Bank, Sun Trust, even Lotus Capital, some of them are participating in this fund. And there are so many other funding opportunities. I remember before COVID, Bank of Industry, they created like 3 billion naira non-interest non-interest funding for Muslims, and that money was to be disbursed through Jais Bank. As at the last time I checked, so I doubt if so many people have really accessed the fund. So those are opportunities available, but like every other funding opportunity available anywhere.
Thank you very much, sir. We really appreciate your response and how you justified the question. Now, Dr. Umar Oseni, you mentioned earlier that recently there's been an intervention by the CBN on non-interest loans. So, are you saying that we can access the loans by CBN and other federal government? Oh, you said you're not in Nigeria. Okay, by the CBN and I'm sorry. There's another question that. Can we access the non-interest finance option of Access Bank run under a conventional banking system?
Okay. Thank you very much, sister.
I'm so sorry, sir. Can you please just do that?
I'm not in Nigeria. That doesn't mean I don't know what's happening there. I'm always here on ground, and I'm always in Nigeria. Now, one thing I'd like to start with is I'm not here to issue a fatwa, so I won't be here pontificating basically. What I know is that there's no difference between very minimal interest rates and huge interest rates. It's all the same. So scholars have said a lot about this question, and I'm not opine on them today. Other more qualified members of the panel or perhaps the next session will be speaking on this. Now, as you rightly said, CBN has provided alternatives, for us to explore through some of the Islamic banks. Now, here is the deal. It's good to emphasize that not all non-interest financing are Islamic, but all Islamic finance products are non-interest based. We have to get this correctly here. Simply saying non-interest doesn't mean it's Islamic. No, when we say non-interest, a lot of efforts go into structuring the products to be purely Sharia compliant. Islamic finance goes beyond zero interest. there's this positive dimension to Islamic finance generally, which is often emphasized under the Maqasid Sharia, or what we call the higher objectives of Islamic law. For instance, in Europe, we witnessed what we call the negative rates since last year. The meaning of negative rates here means when you deposit money in a conventional bank, instead of being paid interest, which is riba, you pay to the bank to keep your money. So the rates actually went so low that they went into the negative territory. So some of our Muslim brothers across the world were saying, yes, this is actually purely Islamic, it's now below, Well, we have to tell them, calm down. Islamic finance goes beyond just zero interest. So if Access Bank, I have not studied the product because normally before I can speak, I have to look at the whole product disclosure kind of document to actually see how it was structured. Now, if they are just providing non-interest option for people, that doesn't mean it's Islamic. You should be aware that when the CBN introduced Islamic finance during the Sanusi Lamido's administration as the CBN governor, what happened then was they wanted to call it Islamic, but because of the controversy across the country, they had to use the word non-interest. So, but when you look at the regulation they introduced, those non-interest kind of financing were to be implemented through Musharaka, Mudaraba, Murabaha, some of these products. So when you say something is non-interest in terms of the financing option, I have to see more in terms of how is it structured, who approved it, who are the Sharia scholars that approved it ultimately after going through the whole structuring phase. Structuring a product, it involves a lot of efforts, I can tell you. We do that on a daily basis, where we have to structure it from end to end and still take it to the Sharia committee. They reject it ultimately because of one maybe error that is somewhere or any other thing, even though there's no interest in it. So I think it's important for us to look beyond just non-interest option being provided by any bank, whether it's Jais, Taj, or Access Bank. We have to look within it itself. People always say that the details is always, or the devil is always in the details. Yeah, those you gotta change that to the angel is always in the details. Yeah. So
Thank you very much.
I don't want to say much on that because I don't have the details, the facts.
Now we really appreciate our Muslim finance coach. We appreciate you for your response, Mr. Fatai Olayemi. We appreciate you as well. We say Jazakumullah khairan to you all. Now we have questions from our audience, and as much as I would like to ask more questions and you doing justice to what I have for you, time has been fast spent, and it's time for our audience to drop questions, sir.
Yeah, let's have the questions coming. I mean, you have the Muslim coach here, you have the developer here. So let's
since we can't see it yet, let me ask the last question for. Oh, okay. I can see that there's no question from audience yet. Now, Mr. Ridwan Sanusi, you mentioned Islamic venture capitalist. Do we have in our ecosystem?
Okay, thank you for that question. I don't know any structured or any institution that labels itself, Islamic financial venture capital firm, right? But we do have Muslims playing in this sector, right? So I'm not going to mention names. I'm sure Dr. Omar also knows those people who actually help to, get funding from foreign investors for these businesses. I mean, the likes of Andela, the likes of Bata, the likes of Flutterwave actually got funding through these people, right? So this is a call to all of us, particularly those who are within the financial space, to see how best we can begin to, put together people that have financial capacity, financial strength, to enable tech guys, innovators, and entrepreneurs access funding, right? So I don't know of any, to be honest, but I do know that we have angel investing or angel investors, club in Nigeria, which I am also a part of. But of course, like Dr. Omar said, what they do in the organization, institution, doesn't really, matter. So what you need to look at is how they structure, this financing. Someone can call something Islamic finance or non-interest finance, right? The detail is what we would have to look at. Okay, so I don't know of any, but we need, finance experts, and more importantly, angel investors to begin to look into this direction.
Now, thank you. I can see a question here. Sakab Lafiz asked that, can we get a brief illumination on the ethical considerations which is Islamic based, involving Forex as an option for investment with regards to salary earners, Muslims who aim at financial stability? I don't know if you can see it from your side.
Yes, I can see it.
Okay. Now, can you please do justice to that?
Okay, I'm going to do justice to that, and I'd also like, Dr. Romero to speak to that as well. All right, so when it comes to investment in Forex, to be honest, Forex is not permissible in Islam. And the scholars have looked at, the Forex market, because you need to understand the principles of Islamic finance first before you can begin to say if one investment option is halal or is haram. And Forex, to the best of my knowledge, right, violates all the principles of Islamic finance, right? Because Forex is a speculative instrument, right? A speculative instrument derives its value from an underlying asset. So if you understand how the Forex market works, right, you would say that they make margins on a transaction, right? So the money that they make on the transaction is not so huge. So that's why they need to do volume of transactions, right? So sometimes those who actually trade in Forex also do lend, right, to the Forex traders, right? So when you see a Forex trainer telling you about Forex, you open YouTube, you always see them right on YouTube. They are inviting you to come and trade in Forex because they know that, the more the merrier, right? And sometimes they do lend. And of course, when they lend, right, the lending involves riba. So Forex, violates the principle of riba, it violates the principle of, speculative instruments. It also violates the principle of sometimes, right, uncertainty, right, and gambling. So I would advise salary earners to look at ethical or non-interest or Islamic finance options that are available by this, asset management companies in Nigeria like Lotus Capital, and others, rather than going for Forex.
Now, Dr. Umar Oseni, can you just briefly make an addition to that?
Well, I think my brother has actually said it all. I endorse everything he has said. Basically, yes, I know there's that kind of challenge in Nigeria where people actually look for, where we can make more money. And Forex actually is always staring at our eyes, all the time. It comes to your email just like that. So I think we try to avoid it. You see, when it comes to Forex, not all Forex trades are actually non-Sharia compliant. But most of the things you have in Nigeria in terms of individual or kind of companies inviting you to invest, I think, as the brother rightly said, they are actually non-Sharia compliant. It's better to avoid them. Deploy your funds to, ethical financing, Lotus and other banks that provide this for you. And if you can do it as well, why not you invest in, some of the innovators and Muslim entrepreneurs? I mean, they are there. Invest in them. Now, the type of Forex that is Islamic is something different, which we use when it comes to swap trading. Swap is a kind of.
Can you come again, sir?
Swap, we have what they call it swap. SWAP. I mean, here it is again structured to be Sharia compliant. So it's not just, oh, I have this kind of Forex involved, log in and you can invest. No, this is done by the bank and they use it for their risk mitigation in terms of structuring a product to deal with other corporate entities like banks, not for individuals. So this is well known in most countries like Malaysia, UAE, and others. It's purely a risk mitigant for the banks, not for individual investors. So I think it's better we just avoid this, and as much as possible, we think of alternative ethical finance. Now, I give you an example finally before I end here. Okay. When you look at MUSDEV, and the good thing MUSDEV is doing, alhamdulillah, we're having this event today. You see, we have a lot of innovators here today. We have a lot of entrepreneurs here today. How can we mobilize them together? Form clusters within MUSDEV itself. Like we're talking about fintech today, we have RecTech, we have other people focusing on education. We just had a panel focusing on health. So how can you bring these entrepreneurs and innovators together and see how we can mobilize funding for them? When we talk about crowdfunding, brothers and sisters, you don't have to wait for Securities and Exchange Commission to get funding. You can do crowdfunding within MUSDEV platform. Come together, mobilize and channel those funds to innovators. But again, you have to have strict rules in terms of partnership agreements that are binding to be enforceable. So those activity like the question we had, they can bring it to MUSDEV platform, and we'll get brothers who can invest them to innovate something good. Yeah, for the Ummah.
So we can contact you anytime, sir.
Yeah, I'm not saying me. I'm talking about them. I'm talking about. Yeah.
Okay. Noted. We say a big jazakumullah khairan to our three speakers. We hope when we have any other program or that we have to discuss anything fintech, we can call you again, sir. Jazakumullah khairan. Over to you, Mr. Abdullah.
Okay, alhamdulillah, I mean, that was an amazing session about us following where the money is. And I think we've gone from 2 stages now. We've had the health tech session, and we've also told us about how we can pursue the money. So, Ibrahim,
Yeah.
what do you think, like, is it the fair of the conventional system that, okay, when I borrow money now, Jais, all of them, people have that notion that they're still the same. Do you think this session has been able to clarify and then how we can pursue the money?
Well, I actually think that the session has actually shed more light on some certain aspects. I think for a very long time I've been getting questions about, especially the last thing they mentioned, forex and all. So how did you go? I mean, how can Muslims go into forex? And I think I tell them most of the time that you don't have to. You have a lot of options rather than going to forex, especially here in Nigeria. So it's actually a really, an eye opener to ethical finance for Muslims, basically.
Okay, that's so. I think we've been hearing a lot about how money and then how to build a working health sector. So I think moving forward now, we will also introduce our next session, because of course our audiences should be aware that we're going to go for a break, and then don't forget that our hashtag is much functioning. Make noise on Twitter about what's happening in life, and then others come on board. So Ibrahim, over to you.
Yes, you can actually use either hashtag MUSDEV 20 or hashtag MUSDEV to tweet and talk about this conference. Now, on to the next session. It's actually something something to be a tech guy, either a front end or back end developer, a UI UX designer. But the question is, do you want to be a middle car or you want to scale? And when I say scale, I mean scale real fast. So join us in the next panel session as we discuss building a successful tech career in a fast-growing digital economy. And to anchor the session is Sister Aisha Babatunde. Assalamu alaikum, Sister Aisha.
Assalamu alaikum wa rahmatullahi wa barakatuh. I'm Aisha Babatunde. Inshallah, we'll be discussing how we can build a successful tech career in this growing digital economy. On this panel, come back.
In today's world, IT professionals such as software developers, data scientists, UI designers, and many more are one of the most sought-after professionals. Therefore, choosing any of the IT career paths is a smart choice. However, as an African, acquiring the necessary skills to become a seasoned IT professional can be challenging. You have to deal with a lot of poorly made instructional materials, courses that make every concept more complex to understand, And if you're fortunate to find a really good learning resource, the cost will be far from affordable. This is why we created UStacky, the first online stock learning institute in Africa that teaches industry-relevant IT skills at a very affordable price. How are we different? UStacky takes you from zero to world class in your chosen IT path by offering very affordable micro-degree programs with detailed, high-quality videos, quizzes, and assignments. Just to make sure you understand every concept as expected. Our programs contain localized content tailored specifically to Africans. And that's not all. We also offer insightful code review to solutions from assignments. UStacky mentors to guide you along on your learning journey. Discussion forums where you can meet other students. And whether you are at home or on the go, on PC or mobile, you can always practice what you have learned with our easy-to-use live code editor. Upon completion of any UStacky micro degree, you get a certificate of completion, resume review, and an opportunity to start earning, either working for UStacky as a code reviewer, working on paid gigs, or getting a job through the UStacky Jobs portal. So, are you ready to become a world-class IT professional and get the opportunity to earn immediately after graduation? Head on to www.ustacky.com or download the app on Google Play Store. UStacky, your stack learning companion.
Welcome back. Thank you for your time. Right now, we have Mr. Moise Oyewole with us. Mr. Moise Oyewole, please say his test link.
In today's world, IT professionals such as software developers, data scientists, UI designers, and many more are one of the most sought-after professionals. Therefore, choosing any of the IT career paths is a smart choice. However, as an African, acquiring the necessary skills to become a seasoned IT professional can be challenging. You have to deal with a lot of poorly made instructional materials, courses that make every concept more complex to understand. And if you're fortunate to find a really good learning resource, the cost will be far from affordable. This is why we created MUSDEV, the first online stock learning institute in Africa that teaches industry-relevant IT skills at a very affordable price. How are we different? MUSDEV takes you from zero to world class in your chosen IT path by offering very affordable micro-degree programs with detailed, high-quality videos, quizzes, and assignments. Just to make sure you understand every concept as expected, our programs contain localized content tailored specifically to Africans. And that's not all. We also offer insightful code review to solutions from assignments. MUSDEV mentors to guide you along on your learning journey. Discussion forums where you can meet other students. And whether you are at home or on the go, on PC or mobile, you can always practice what you have learned with our easy-to-use live code editor. Upon completion of any MUSDEV micro degree, you get a certificate of completion, resume review, and an opportunity to start earning, either working for MUSDEV as a code reviewer, working on paid gigs, or getting a job through the MUSDEV Jobs portal. So, are you ready to become a world-class IT professional and get the opportunity to earn immediately after graduation? Head on to www.usdaki.com or download the app on Google Play Store. MUSDEV, your stack learning companion.
Assalamu alaikum wa rahmatullahi wa barakatuh. You are welcome to this session. Inshallah, we'll be discussing how we can become a successful career, we can have a successful career in tech in this growing digital economy. So as we are rightly known that the Nigerian tech ecosystem is fast growing, and it has produced global businesses like Paystack, and of course world-class professionals, including developers, designers, and product managers. As we know that the tech ecosystem provides life-changing opportunities, and that is why many people are rushing to explore the opportunities that are available for us. So, and then we know that the Digital Economy Ministry in the last quarter of the year, the NBS data that was released, it contributed greatly to the economy more than the oil sector. That is, the non-oil sector which included the ICT Center, contributed more than the oil sector that Nigeria depends on. So, and it is important for us to use this opportunity to know how we can achieve a career successful life. And then, inshallah, and our panelists will be discussing how we can utilize the right strategy and the right strategy to arrive at opportunities. And of course, they will also mention how we can overlook the challenges that the platform also offers. So, inshallah, with me is Mr. Moise Oyelowo. Mr. Moise Oyelowo is currently
Oyewole, please.
Oyewole, pardon me. Mr. Moise Oyewole is co-founder and chief technology officer, Magtech Pro Technology Limited, and then the company is one of the partners of Google in Africa, and is also a consultant to many organizations, both local and international, on digital transformation and cyber security. He's the EC Council trained certified ethical hacking. He's a Google Cloud professional architect and Microsoft certified developer. He holds a bachelor degrees in engineering, in mechanical engineering, design and automation, and postgraduate studies in information systems and management from University of Salford, Manchester, UK. And he has been a facilitator and a mentor. So he joined the Google developers ecosystem in 2010, with many of his mentees attaining certification stage, and he was also part of the pioneer developer that participated in Google Get African Businesses Online, GABO, and then Get Nigerian Businesses Online, GNBO project. He was the Google developer lead for the Lagos State University ICT team in 2012, and his journey in the tech ecosystem started far back in 2001. So he has over 15 years experience, and he has trained many developers and software engineers and architects. So here he will be taking us through how we can explore opportunities and challenges in the tech ecosystem. Also with me is Mr. Jimo Damilola. Mr. Jimo Damilola is a senior full stack developer, client at IOSOR. He's an experienced JavaScript developer, a mobile expert, and is proficient at building responsive design and handling cross-browser compatibility issues. And he's currently he previously worked with Limbic Labs in England as a full stack software developer, and also at Time Dr. LLC in Las Vegas. So inshallah, they will be taking us through the discussion. Assalamu alaikum, dear panelists.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Oh, how are you doing?
Alhamdulillah.
Mr. Damilola, are you there? Can we have you say Taslim? Okay, so inshallah, right to Mr. Oyewole. I got it right this time, right?
Yeah, you did.
Okay, so inshallah, you'll be telling us so far. First step, what do you make of a career in tech in Nigeria's growing economy?
Okay. Alhamdulillah, today it's my joy to have the opportunity to interact with my colleagues, the Muslim brothers, and in the tech industry, and also learn, because in situations like this, we are more positioned to learn than to share what we have as experience. So when you talk of the tech career, interestingly, it's beginning to evolve more rapidly. I can remember far back in 2011, 2010, 2011, when we have caused to hold sessions with colleagues from other parts of the globe. It's usually very challenging to find Nigerians in the space that could actually come on board to also speak of their experience and talk of what the tech industry has of opportunities. It's far long ago, myself and a few other brothers have advocated for Muslims to massively move into the tech ecosystem. We have the tech, IT and agriculture as the industry of the future for anybody that actually wants to be relevant. And when it comes to the tech ecosystem, it's a very wide one. And in particular, Nigeria, we've not actually explored 20% of what is out there. So what we usually have are, I can say we have primarily developers and let me say some network administrators. These are the areas where we have the largest percentage of Nigerians, whereas the industry is very wide. For example, in the aspect of embedded systems, which later birthed into IoTs and so many other, before we have artificial intelligence and machine learning reform and revolutionize that sector. What most people perceive as tech is just programming and little hardware and networking. And it's far beyond that. Technology is wide. By the time we begin to look at the health industry, for example, 8 years ago, I remember there was a research of a robot smaller than a cockroach that actually is designed to walk into the nostrils to diagnose the pulse of fluid in the nostrils to determine certain complications in the human body. And this is as far back as 8 years ago, and I'm not sure many of us in this part of the globe are aware we have that much of development out there. But it's now far much different. So in Nigeria, what I can say is we are gradually catching up, but it is much more than we picture it. So for anybody seeking a career in tech, what is most important is start somewhere. And that's what I would say. Start somewhere. You will see so many things so overwhelming and you want to be part of everything. But like they do say, a jack of all trades is master of none.
Master of none.
You don't start with everything. Start with something and be very good at it. Then when you are very good at that, then you can begin to explore further. Well, I will stop at that. Thank you.
Yeah, thank you. Pardon me, a while ago I skipped our panelist. One of our panelists is Mr. Sadiq Akinjobi, popularly known as Geek Tutor. He's a WordPress babalawo, Fluzard, and a PhD developer. He's a community builder and is currently building a lot of tech communities, both in and out of several school campuses. So you're welcome, Mr. Akinjobi.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you for the amazing work that you are doing, and thank you for having me today.
It's good to have you here. So, Mr. Akinjobi, it has just like what Mr. Oyewole said. Nigerians are showing interest in the digital ecosystem, and then just recently, after the cashing out of Paystack, a lot of Nigerians, actually visited Free Code Camp, a web development teaching website, Free Code Camp, and then like it shows that there has been an improving and increasing rate of interest in the career. So, what can you say about knowing what to do really when you're choosing that path in the tech ecosystem?
Okay, good question. The thing I've noticed is that a lot of people are getting into tech because they are finding it as they're finding it easy because they think it's easy to just get into tech and just get started because they see it as a get quick rich scheme because it is easier. Tech has a lower barrier of entry. In order to be a doctor, you have to go to school and you have to graduate and then you have to practice for so many years before you can be established in the industry. But with tech, in 2, 3, 4, 5, 6 months, you can get started, whether it is coding or it is project management or whatever skill it is that you are looking at, and you can get started with it and go on like that. But what I have to say for people that are getting into tech is that don't see it as a get quick rich scheme. You have to put in the hard work so that you can establish yourself and be grounded in the knowledge. And then the only way to tech is not just coding. There are a lot of other fields. As you have heard from some of the panelists that spoke today, you can apply tech to healthcare, and there's telemedicine, and there are a lot of other things that matter, not just coding alone. So you need to look at all the industry and find your own place that works for you. And then when you find your place that works for you, you can now use that to now pick and find your space in the ecosystem.
Yeah, thank you very much for that. Just like what you said, it is important that you know what you're doing before heading to what you are about to do. So that brought me to this question that what particular certifications, like we know that certification is very important because before you can pitch your idea or your professional outlook to a prospect employer, you have to show certification for that. So we know that certification is very important. So which area do you think, or do you think people should only focus on certification?
For me, I don't think that certifications are, personally for me, I don't rate certifications because I believe that skills is more important than certification. So you can have all the certification in the world. If you can't do the actual work that is required, if you are given the job, it means that you are going to do a mediocre job at it, or you are not going to deliver. So much more than certification, and that's what I've noticed about tech. Tech does not put a lot of emphasis on what degree do you have. What they will most likely ask you is, what are your projects? Display your project for us. Let us see your project. Let us see what you built. Let us see what you can do for us. Not did you graduate from Harvard? Of course, for the senior roles and the management roles, certifications are very important here. So that's why you see that it's very rare for you to see a manager who is not educated or did not graduate with one degree somewhere. But for the developers and the entry-level customer care agents and the likes, it is more about what you can do more than what certifications do you have. So both of them, you need to find a balance, like I said earlier, and know which path exactly are you going. And then along the line, as you start, you can always pick up new skills along the line to be able to know what's next for you in your career and what exactly you want next.
All right, thank you. We welcome our third finalist, Mr. Jimo Damilola. Mr.
Hi
Jimo Damilola
everyone.
is a senior full stack developer. Hello, Mr. Damilola, can you hear me?
Yes, I can hear you. I can hear you.
All right, sir. You are welcome.
Yeah, thank you very much.
Okay, so right to you. Just like what
Okay.
Mr. Kinjobi said, he said skills should be prioritized over certification. So, what particular skills, what soft skills do you think a Muslim should have to help him or her to grow in the career?
Okay. So when it comes to soft skills now, so I would say the most important part is communication. So once you are able to communicate properly, and don't get me wrong, so communication doesn't have to be spoken, like doesn't have to be like how well your English is or how well you are able to like communicate with others, but it could be more. So it could be your writing skills. It could be your speaking skills or your empathy when you are communicating. So how well you are able to communicate your ideas so with your teammates or with your stakeholders. So apart from communications, we have your teamwork ability. So ability to be able to work well within a team or alone. Then we also have your leadership skills. You have your how flexible you are when given a task. So for some people, they have the ability to be able to handle tasks. It could be, for example, where we are. So we have as they are able both the front end and also the back end. So I would say as a developer, you should be able to be flexible. But yes, well maybe later in your career you might decide to maybe focus on one part, but when you are starting, I think it is very much easier for you to get opportunities when you are like when you have like a diverse skills, when you know a bit of everything in tech. So yeah, I would say that is one your soft skills.
Thank you very much, sir. Now, over
Okay.
to Mr. Oyewole. Just
Okay.
like we said, digital economy comes with many opportunities. Like, what are the emerging areas that has a scarce personnel and good pay?
Wow. This is a very interesting question. When it comes to emerging areas, yeah, I will start from the emerging areas that have begun to get a lot of patronage, and that is the prominent machine learning and artificial intelligence. Everybody today wants to become a data scientist. Yeah, which is very good. But a lot of people are not paying attention to things like cybersecurity. I don't know. I can't count how many Nigerians are certified ethical hackers, licensed penetration testers, and these are top global certifications that actually are scarce. And this is the COVID era where we have the digital normal, where it's becoming everything online first. And in such a situation, you have organizations begin to look at the cost of securing their digital assets. And we're looking at and the landscape, the threat actions, and what the types and uh, the attack systems are beginning to evolve in a very rapid approach that even more experienced analysts are beginning to wonder the trend. Look at the example of the Twitter hack. This was more like a it's a social engineering attack, but targeting not the users but the admin in a way that they don't actually compromise the platform in itself, but they compromise access to the platform. And I can remember as the CEO of EC Council he said one of the common trends in that is the trident attack. Trident attack is one that combines phishing, smishing, and phishing. So, well, I don't want to dive so much into cybersecurity, but it is a very interesting sector. Okay, but to make it clearer so that people don't begin to tell me what is trident attack. So, an example of a trident attack is, okay, take a bank, for instance. The senior officer sends a mail to a junior officer to effect a transfer, and he knows this is the authorized line of action. And he does that with a phishing attack. Somebody clones the identity of the senior officer, send an email to the junior officer to get a phishing attack. And following that is a voice call, which is also a clone, saying, please treat that email. And following that is another SMS, says, please treat with urgency. So you receive an SMS, a voice call, at the same time, an email, asking you to do the same thing from the same person. It's very difficult to doubt that that is originating from the right person. So this kind of attack are now prevailing, and so the need for cybersecurity experts is so wide, is so high, and the scarcity is obvious, not just in Nigeria, globally. So that is one of the areas. Another area where we actually need to pay attention to is smart agriculture. We need to. That is unique to Africa. We have the potential to, particularly in Nigeria, we have the potential to become the global hub for agricultural products. And that is why the Ministry of Communications and Digital Economy is focusing on agriculture. Now, how many Nigerians can actually fill in that sector? It should actually be an eye-opener for us. How do I actually plug into this? Everybody wants to do fintech. Yeah, beautiful. Everybody wants to do AI. Yes, but how do you apply it? In which sectors do you apply it? So sometimes it's not actually about which area, but actually how. What do you do with it? So and I don't actually usually say, I'm not a proponent of go after anything new. It's not necessary you go after anything new. It can actually be you doing the same thing that exists, but in a different way.
Yeah.
So if you actually look at what Paystack tried to do, you can see Stripe acquired Paystack because the ideology is similar. They actually try to solve the payment solution in a way that makes it so easier for those that actually are the prime movers of that sector, the developers. The same thing Stripe does in the US. When PayPal becomes, and the authorized net became very cumbersome to assess. Now, so they actually did the same thing that has been done, but in a different way. So I actually advise more of focus on impact. Maybe the same sector, but actually do it in a different way. So that is usually my own